And welcome back to the show. Joining us now is Dr. Beck, a leading expert in gynecological oncology and robotic surgery, who's at the forefront in advancing care and research for women with cancer. Dr. Beck, thank you so much for joining us.
Thank you for having me.
I appreciate you coming to the show. What you have to talk about is so important for women, and I think they're going to really value the information.
I'm so happy to be here. Thank you for having me today.
Thank you. It's been a while since you were here.
Yes.
Tell us about your role at Hoag.
So I'm a GYN oncologist, or gyn-onc, at Hoag. We are a specialty of surgeons who also provide chemotherapy for our patients. And we have a full spectrum. I'm one of 6. I have 5 amazing partners. And our job is to take care of women with cancer as well as complex surgical needs. So the majority of our work is caring for women with cancer, but we also take care of women with benign disorders who need complex surgeries through small incision approaches. And that's our sort of robotic expertise at Hoag as well.
Mm-hmm, mm-hmm. And that the robotics is making surgeries so much safer?
It's making the recoveries much easier for patients and really lets us do a lot with less impact on patients, getting them back to their lives a lot faster.
Okay. So what would you like women to know about the GYN cancer program at Hoag?
Yeah, I think one of the most important things to know about our program is how comprehensive we are. At the Hoag Family Cancer Institute, we have so many colleagues that help us take care of our patients. So, we work to do the surgery and the chemotherapy, but we do that with a team of people, including nurse navigators, social workers, and Hoag has really done a great job of taking a whole person approach. We have a Hoag for Her Women's Wellness Center where our cancer patients can receive therapies like acupuncture and guided meditation, oncology massage, and then I also work very closely with our medical oncology colleagues who work with us in our breast and ovarian cancer program to make sure that we're taking care of sort of the whole woman.
Right, yes, yeah, not just bits and pieces here and there. So what are the common things that you would like women to be aware of and ways to screen?
Yeah, absolutely. So, I think everyone knows that they're supposed to get their mammograms and that you're supposed to get your colonoscopies. But I think outside of that, a lot of women think that once they're done having kids, that they're sort of done going to the gynecologist and that they don't need to worry about that anymore. But there's still, total health care that needs to occur. And so I think one of the most common things that people don't realize, especially in the perimenopause or postmenopausal area, is that things like abnormal bleeding always deserve an evaluation. Things that are different or changing in your abdomen or pelvis that have been going on for several weeks and you can't explain. The normal things to treat things like constipation aren't helping you. They deserve an evaluation. So someone should see their gynecologist or their primary care doctor to figure out, is this normal or is this something that needs to be evaluated to make sure that they're safe?
Mm-hmm. Otherwise, is it true that they can go every other year, every couple of years in between appointments?
It depends on what we're trying to evaluate. When it comes to things like pap smears, for instance, that is an area where we've actually made a lot of advances. It's gotten so complex that doctors actually have an app for that now to try to help us decide when does a person need to come back, what's their risk of developing a cervical cancer within a certain amount of time. And there are some people who say that, we can stop doing pap smears at a certain age, although in oncology we do see that cervical cancers tend to occur in women in their 30s and 40s, and then a second spike actually occurs in postmenopausal women. And so, it's really important if people are having something going on that they get evaluated, that just because you're done having kids doesn't mean that your pelvic health is not important and need to be checked on.
Right, absolutely. Mm-hmm. So you have current research ongoing,
Yes.
Current research always being done. What are some of the clinical trials that you're working on?
Oh, we have so many. So at the Hoag Family Cancer Institute, I checked yesterday because this is a constantly changing number. We're always working to bring the latest and greatest science to Hoag. And as of yesterday, we had 110 trials open in the cancer space.
Wow.
And I think I have about 13 of those in the GYN space, or women's cancer space. Some of those trials overlap, meaning they include both women and men. But we have everything from first in man, early science, really exciting and novel approaches to treating cancers, to phase 3 studies where we've developed something that's really interesting, and now we're trying to compare it to the standard of care to see how best to use it in the general population. So we have such a broad spectrum of things that we're offering. We've had some really great new leadership come to the Cancer Center that's really helping us continue to move the needle forward and treating cancers and doing research at Hoag.
It seems like Hoag is at the forefront of a lot of different areas.
I feel that way. I feel very, very blessed to work there because all of my colleagues are passionate about what we do, and all of us are trying to constantly do better. And I think that's how you move the science forward and how you continue to get better and better outcomes for your patients.
Yeah. So, what do you think we can hope for the future for women's cancer treatment or prevention?
Yeah, we've moved, we still use a lot of the traditional things like chemotherapy and surgery, but we've moved beyond that in a lot of ways as well with advances in immunotherapy. We have studies ongoing in cancer vaccines where we sort of create a vaccine from your own body or from your own cancer cells and are able to give that back to people. We're using cancer-killing viruses. There's so much interesting innovation that's happening that we have a lot to look forward to. Just in the past couple of years at our annual meeting in GYN oncology, we've seen some studies that have come out that have been absolutely practice-changing that have moved forward the survival for women with things like uterine cancer, the most common cancer I treat, on the order of more than a year difference in what we can see with a small change in the therapy. So we're really seeing some huge improvements.
Dr. Beck, do you understand, does the medical community understand why cancers are, I'm going to use the word attracted, although I know that's not the right word, but why do they seem to go to one part of the body versus the other?
That's a great question. I think cancer by definition is a mistake, right? Our cells are always turning over. We're constantly refreshing, making new skin cells, making new cells throughout our entire body.
Right.
And with those turnovers, there's the opportunity for a mistake to occur. When a cell, has to pass on its information, it can make a mistake. Sometimes those mistakes are genetic, and we have an outstanding program in genetics at Hoag to help families understand, do they have an elevated risk of cancer, and can we help prevent that in other family members? And sometimes those mistakes are just mistakes, and they can happen kind of anywhere. Sometimes those mistakes could happen because of an environmental exposure and a vulnerability. Mm-hmm. I think because there's such a broad spectrum of how cancer can develop, it's really important to realize that there's not one answer to all the different types of cancer. It's important that we really take an individualized approach to each person and to each disease.
That's why it seems like the ongoing scientific community is trying to find a cure.
Yes, absolutely.
Because it is so mysterious, right? And throughout your time period of being in your position, have you seen either an increase or a decline in the numbers that are coming in?
Yeah, the public health data is really valuable to us there. And so we've seen that certain cancers are on the rise. For instance, endometrial cancer, again, the most common cancer in GYN oncology, and that number has been going up. The number one symptom of endometrial cancer is bleeding after menopause. So, and it's usually not painful. It's usually not anything else. It might just be a little couple of spots or, something that people notice on the toilet paper and think, oh, that's nothing. But any bleeding after menopause is not normal, always deserves an evaluation. Because we are seeing that one is going up.
Mm-hmm. Wow, okay. So what makes Hoag different when it comes to cancer care?
Yeah, we understand that people have choice. Here in Orange County, there are so many excellent physicians and competitive institutions. What I think makes Hoag special, and one of the reasons I'm so happy to be there, is that we provide really comprehensive care. I think a lot of people view Hoag as their place as their home for their primary care physician or their heart specialist. And I think when you have something scary happen like cancer, you want to, say, where can I go? Where am I going to get the best absolute treatment? And a lot of people don't know that we do research and that we have all of these things at Hoag, and that we can provide them that cutting edge care right with their other doctors and their teams. They don't have to leave their home to get that amazing comprehensive care. And when you have surgery, if you've got other issues like a heart condition or something like that, it's wonderful when your heart specialist can also be a part of your team in the aftercare. So the fact that we are not just a cancer center, but that we really take care of the whole person on a really team-based, multidisciplinary approach, I think really improves people's outcomes and experiences.
Yeah, Orange County, we're so lucky to have
We are.
Hoag here. You've got several locations. Where are they?
Yeah, so in GYN Oncology, we have offices in Mission, in Irvine, and in Newport Beach. And sometimes those things are moving and expanding kind of where the patients need us or where we're seeing that the volumes are the highest. So we try to make sure we've got access for patients wherever they need to be. Our surgical centers are in Irvine and Newport right now. Hoag just opened a new outpatient surgery center as well in Irvine. Hoag has places pretty much everywhere. I feel like you can drive down the street and see primary care kind of anywhere and make sure that you're getting that basic care. But we are also expanding our centers of excellence to provide that specialty care.
Wonderful. Well, thank you so much for your dedication to this work. It's incredible, and I know that a lot of our viewers are your patients.
Yeah, I'm so happy to be here. Thank you for having me.
Yes, valuable information. Thank you for being here. All right, everybody, you are watching This Day on Village TV.